Okay. And how many of those have been at Western here? And how do you use the Romeo system, the online system? All right. So for those of you who have used the online system, this will be a bit of a refresher. I'm going to go over how to get our kind of account and whatnot. But for those of you who have not used the system, this is to be brand new. So the first thing you need to do when thinking about starting your research is make use of a Romeo account. So Romeo is our online application system. So everything in our office goes through the Romeo system. Log on to our website, and it's all right. You'll go to Romeo Investigator form, and that will get you an account. If you don't have an account, you can't log into the Romeo system. You won't be able to share it. So that's the first step there. Make sure you have a Romeo account. That's done by submitting that form. It's a manual process that happens in our office with our administrative staff. So it takes about 24 hours. If you need it faster than that, you can also call them and they set up over the phone. But it is a manual process. So it doesn't happen. The second step is figuring out who's responsible for your project. So only research eligible faculty members can access the physical investigator on a project currently. So our office business process, I'll be visiting this to see if that can be expanded at all. But currently it's only research eligible faculty investigator. And that personal investigator is fully responsible for everything that happens in that study. So for the research students, the research participants, for the research proposal, everything, they're responsible for that. They are signing off their name on that. In saying that doesn't mean that as the research students or the research, or the person carrying out the research, that you can't do the entire Romeo form. So you can go onto the Romeo form, you can get your application completely ready, and your personal investigator can go in and review it and submit it for you. But that person is responsible, and they are taking full responsibility for everything. Any questions about that?
Yes. See, this is new information for me. So I just want to clarify how this is working. So, of course, these are students in the program. Each of them has a supervisor who's either full-time or in the part-time faculty member, contract faculty member. The research is not funded, so it doesn't have a formal physical investigator membership by council or anything like that. Does this mean that we as supervisors have to sign off to be involved in the process to make it equivalent?
You don't have any contractual practice member. So you can't have a student signing off on your responsibilities if you have no relationship. So there has to be someone who can take responsibility for that study to be accountable.
Okay. So what we want to do is really learn about as supervisors how to get into the process and what to do.
Exactly, and that's really important, right? So it's important that the supervisor, so what we, I guess I'll start with kind of what we see happen in the past. The supervisor kind of let the student take full run at it and kind of has a hands-off approach, but you don't want to. You want to see that, well, we understand the student's project, that person is still responsible, and the supervisor generally has a little understanding of them, they're good people with them. So you want that as like a student experience person kind of helping that student get through the process, right? And just the process and and we are reviewing this, so it's maintained. There's not a thing to keep checking our website to see if that does change, but for right now, it has to be something to do.
No, it's not appropriate to have a long debate here, but for years now, I've supervised 8 to 10 of these ones at a time. You just said that students can't be accountable. I don't understand why a student can't be more accountable than I am for such a thing. Why are students not accountable?
This is a policy meeting. This isn't just our office, right? So
I realize you're just a messenger, so I'm trying to
and this is something that
constrained as I can.
Yeah, and this isn't, you're not alone in those right? So this is something we are working on, and I can't, I mean, this is the focus we're using currently, and I know it's probably, because yes, we want our students to be responsible, but we also don't want, we also have, you know, they can, at this point, here, they won't, we have no agreement to other stuff, so.
What does it mean for me to be accountable for what the students are doing? Well, if the student's out interviewing some municipal officials, how am I supposed to know what they're doing?
So, I mean, you're going to be providing guidance on what's right and what's wrong, like in research, and you know, things that they are or should not be doing or carrying out research. And it becomes tricky because you're the supervisors, like, in some cases where people are looking at someone who's not a supervisor, they have found somebody who can fit this role, right? So we want you to be able to provide that guidance, that mentorship to ensure that they're doing the best experience out of carrying out their research, and that they understand from someone who's gone through this process, who's done that research before, kind of what's right and what's wrong.
Just one more point to reiterate what Martin said. We have people in this program, instructors, or contact faculty who are working their main job is in municipal government. They haven't had a long history of doing this. So the student is more likely than as likely to know what to do as the instructor.
And that's important. So I think moving forward as this conversation gets going in the university as a whole, that's important to know, because we don't want somebody who has no idea what that student actually does and just signing off on their protocol to be responsible for it. I mean, it doesn't make sense. I mean, I've seen it in the past where a student is doing research in X, and the supervisor only does research in Y, but they're signing off on it because they're the appropriate person at that time to sign off. Then you have someone who really can't mentor because they don't understand the methodology, they don't understand the procedure, they don't understand that part of the research, and then they're actually workshops in the. So we want to make sure that when this conversation keeps going with administration, that who's there all first, and what is the actual responsibility? How are the people that they have to, or the supervisors actually responsible? What kind of training is there to ensure that they're actually responsible for the student life? And so this is a much bigger conversation. So I
wouldn't say anything.
Yeah, and I'm not trying to put it to bed there, but I know that this is something that we talk about for days. In our office, we talk about it time and time again, and I just want you to know that we are working on this. This is a bigger issue than everybody mentioned today. So we are working on it, and I hope to have some time to update on that. I'll go back here first.
So this is separate from these five connections. What we haven't talked about and because that other issue will really have to be resolved. There are a limited number of these faculty, a large number of students that can test the funnel through people maybe.
Yeah.
But that is separate question. Okay. Which is, let's say I have a student who by virtue of the project that they want to master public is going to be interacting with an at-risk population. So they fall on that part of the grid, or on that part of the grid. If I am responsible, I'm the PI. The responsibility and for the liability, I can guide them all I want.
Yeah.
But if they go and cause problems, who's liable?
Yeah, and that's something that we really need to really, as we go through this process of defining this, as to where that falls, and what is in that agreement between the supervisor and the students. So that's something we're also looking at to make sure that we're fully aware. I think right now I have been told that the faculty agreement is clear and people looking at what that means, but we are looking at that as well. So liability, responsibility, what those things together. So these are all really great questions, and all I can say at this point is that we are working on it, and hoping that there's more information I can give you maybe if I come back another time or on our website shortly. I know that there's a document being put up hopefully beginning of next week in terms of this, but it is a conversation, and I don't know. So Mark Daly, he's the Associate Vice President for our office, and he is helping us with that. So he's a faculty member as well, so he's helping redefine this and see where we can move with that. But it is a question that's very much on the table, and we want to make that very clear for everybody so it's understood by everybody what the responsibility and what the stand. So thank you for all the questions, and I will bring those back when we are in that conversation. I'll go over here next and then back to back.
I'll just build on the previous two. I mean, all of this is absolutely brand new. And I'm a part-time faculty member. My experience with most students I've supervised is that they follow the rules, they use good judgment, they're not doing anything, and they haven't done anything that would be suspect. But then there's plan B, the student who is the renegade or uses bad judgment, or they're pressed for time, and I don't know. So it's not clear to me, accountable for what and how held accountable. Because I'm not sure, it's non-medical, and I can appreciate that in the medical area there's huge issues that we need to protect from. But I'm not really clear on this post where, even with some at-risk populations, but where the, what the liabilities are, is this
So that's my understanding. But this is the collective agreement, and it's part of the MAP policy. So that I believe in that policy.
So what's the worst that can happen? What can we do?
What's funny is something can happen where you're the responsible for that fear is the student does something wrong. I mean, the worst that can happen is that the student's data that they're taking away the semester doesn't help to ensure that the data is not being mentioned in their practicing. That's kind of the worst that's on this side. Medical side of works in terms of position. But again, my understanding of it is that the clinical investigator, as the person who has signed the collective agreement with the university, is responsible for the supervisory role. And that means that in all aspects of that. So that's another thing too that I am working on trying to define is what does that like what does that mean for the liability, responsibility, and what is supervisory responsibility. So I think we have a long way to go in our offices to explain what that define that. So that policy again will be to define that for you. So I think that's the way to start with in terms of the university, not our office. But we are trying to define that. So I will leave it at that. And it's on the third slide. We're already 10 minutes in, so I don't want to think about it too much. But I do want you to know that we are working on something that has been kind of really reignited since our beginning in the office. So we are working towards resolving that and redefining or clarifying that for everybody so it's really more clear. So it's important to know, it's very important that way. And so I know the hospital side, on the hospital side of things, on the medical side, all of the hospital physicians who are possibly in the university, they all have to go through a qualified investigator program. But they have to go through that before they can actually conduct research anyway, right? So that's how they've gone along the avenue with a hospital policy, but we're not doing anything that way. So we have to help define it on this side as well. And so yeah.
And the other thing to that I would say from my own experience is that that's why we do such a thorough review during the application process so that we can look for potential areas of concern so that we can try to put in safeguards and work with the PI and the students to ensure that certain liability concerns and those sorts of things that could be foreseen are addressed in advance so that if this situation were to occur, there would be something in place so that you know how to respond to that to try to mitigate some of the liability to others.
So we do as much as we can do on the review side of things, but there is still a lot that's needed on the definition of what that means on our side, especially if it's very new to a lot of these. So that shows me that we're not quite doing our job as well. We should be doing that have to go there as what that means. So we will work on that, and I'll take everything back that I heard here today to make sure that that's part of the conversation, and we'll hopefully report back. Any other questions before we move on? Okay, so we'll continue on, but I do want to tell you that I will be working on that. It's not put to bed yet. After you finish, you can be responsible for your project. You have to figure out what level of review is needed. So we do have two different REUs at Western here. So health sciences and a non-medical board. So the health sciences board with all health sciences board does all patient-related research, clinical research, anything within kind of medical intervention, medical treatment, medical devices, things like that is on the health sciences side. Anybody in this room doing any kind of patient-related work? So we'll stick to the non-medical side for today. So non-medical research board does everything that would be non-patient, non-clinical. So the non-medical board has two different levels of review. So full board would be your higher risk research projects. You're dealing with a vulnerable population, a higher vulnerable population, and a higher risk research question or research project. So for example, someone who is a child. So a child isn't necessarily a vulnerable population, isn't necessarily a vulnerable person, but if you're going to start asking that child about sexual abuse and things like that, that's going to be a high risk question. That could move into a full board shot. So things dealing that we would be moving into a higher risk question or procedure, those would go to a full board. For the most part, we pick the delegated review, so we get about 10% full board per year, and the rest are delegated. So for the most part, we're going to see a lot more delegated studies. So delegated would be your lower risk projects, so less vulnerable population and a lower risk research procedure area. Any questions about that? If you have any questions about what level of review you're going to need, just contact one of us if you want to help you with that. The good thing on the medical side is that we only have one application form currently. So you submit that one application form and it can go either way. So it's not like you'll submit the application form and we'll be like, actually, you should do a different level of review. We'll send it back to you. No, it's just one application form and it can go to either level of review. Unlike the health sciences side, they have 3 different forms. So the non-med side is a little bit more straightforward in that way. The next thing, so once you figure out what level of review you need to figure out if the deadline is only the full board protocols have to go through a meeting, and so only those full board protocols have deadlines. So we just had a deadline this week for the non-medical meeting that will be on March 4th. So the deadline is usually about 1.5 weeks before the meeting, and all of the deadlines are posted on our website on the board deadline. So it's imperative that if you see your research project will be done that March 4th meeting, and that protocol was submitted by the past Wednesday and going forward with the meeting. So the unfortunate thing at this point is that we only meet once a month for the non-medical full board. So if you miss that deadline for the full board, it means you'll be waiting another full month. We have been working on, we have been in conversation about whether we add another meeting. So we have one every 2 weeks like the health sciences side does. We just don't have the volume at this point for the full board protocol. That's something that we do keep revisiting. So right now it's only once a month that we meet, so just make sure that you are aware of those deadlines. And
we put an internal deadline for our program for full-time students in the guidelines of April 1st, which you'll see in there. And that's just to ensure that those of you who do end up going through ethics review have enough time to have that turned around and move across. So that's not a research ethics deadline. For your office, that's a deadline for us. Full-time students.
Perfect, yeah. So that's the important thing to remember though, is that if you want to be starting to integrate register, you will want to get it in by the next deadline for April 1st. So it's done kind of because it's March 4th on road now really fast. But you're going to do
and I also think we will have I'm pretty sure we'll have no people.
Okay.
So I don't think we need to.
So we're on track. Perfect. Thank you. We can explain what things like always. Yeah, so I just went through that. So for delegated review, So we have the two different levels of review. The full board review, your higher risk, more vulnerable population, higher risk research users. Delegated would be lower risk and non-vulnerable population. And so you would delegate who's it delegated to, what is it? So, okay, sorry, I took the question wrong. So the full board, we have 13 different members who sit around the table for the full board meetings, all from different faculties and departments across campus. They also include someone from legal, ethics, and select community members, just so we have a board there. The delegated review is delegated to only one board member, so one person, usually someone from within your faculty or department, and one of the ethics. So delegated to two people. It doesn't really mean anything in terms of the time it goes to, because, like I just said, we have one full board meeting per month, so depending on when you get your application in, if you submit it a week and a half before the full board meeting, you could actually get your review back to the full board and get it delegated, so it doesn't really change the time of things. Any more questions on that? And then, so once you know the deadline, if there is a deadline, you know what level you're committing to, what kind of research work, what kind of research are you submitting. Logging to Romeo without accounts is created. So like I said, those users who have already used Romeo have been in the process before. So Romeo, when you log in, you'll have two sections up here. You'll have the role principal investigator and role project team member. And I'm trying to focus on project team member here because if you're not the principal investigator, this is where all your applications will fit. So like I said, if you're not the principal investigator, you'll still be able to complete the entire application form in Romeo and then save it, and then your principal investigator will be able to get that for you. And everything that you see over here as a project team member will be mirrored over here to your principal investigator. You'll be able to do the exact same thing. Forms of non-medical board. So you use the non-medical RID application form version 3.0. That will be used for all non-medical applications. So patient-related research will do the first three forms here. If we're not doing, so we'll always do this one down here. And then just a little note on that. So we did just revise our form beginning of August. So for those of you who had submitted before August of the past year, the form will look a little bit different than it does now. We did have a lot of input from all the board members that we had from on the board and non-board members as well to try to revise that form. So we read that form, make sure that the questions we kept sending back to researchers time and time again were all worked into that form. We tried to get some more clarity on some of those questions, just to make sure that we weren't kind of throwing a question out there and it wasn't clear, and then we just try to figure out back and forth what we were talking about. We tried for increased clarity on those questions. We shortened the form a little bit. I know it's sure we it doesn't seem like it's shorter, but it is shorter than the first time through. And I think for the most part, the reviews are actually a lot more straightforward now because we're getting that information to the review. The one thing that I see as a board quite often, especially with the full board protocol, is applications coming through the full board meeting is a little bit more complex. You sometimes just can't understand what is actually happening in the application form or in the application protocol. So we want to make sure that it's very clear in that protocol what's happening, because only one person sitting on the table at that time will be an expert, not even an expert, but will be from your faculty, and the rest of us will not be. So it needs to be very clear to us what you're doing, so we can actually provide the right level of assessment on that application. Any questions about the application form? I'm not going to go through the whole Romeo process. That would take us, a whole session. But I'm happy to do one-on-one sessions on that, or come back and do a session just on Romeo if needed. But I do want to cover the consent process today as well. So get to that. Yeah.
I'm just wondering, this is stepping back. I hope it's useful to do so at this point in time. The first question you said, or you asked, is do you need ethics review? And you pointed to the Tri-Council guidelines. We've always, program in the past, had a basic rule of thumb about ethics review, which, and I wanted to see whether there's a shortcut, because I don't want to make everybody go and read through the Tri-Council guidelines. Where there is a shortcut, this applies. So our basic rule of thumb has been, if you are interacting with human beings and you are asking them about more than just basic factual information, like where do I find this, where do I find this set of data or something like that. So if you are interacting with human beings through surveys, focus groups, or interviews, and asking them about their opinions, and those are the instances in which you.
That's right.
Does that make sense as a rule of thumb?
Yeah, and I'll just clarify that, and it's going to come from one of my slides a little bit later. So the only section you really have to read for your opinion through is section 2 of the Tri-Council policy statement. And the only reason why it might be very important for this group of people is because public observation wouldn't require approval in all cases. So that's section 2.2, I believe, of the Tri-Council policy statement, and I'm going to go over that. Or using secondary use of already collected data. That's an already collected anonymous data. So things like that may not require this approval. So, in that case, again, it's still okay to check with us. You can call or email us and ask a question. And then we're happy to write exemption letters as well in case you need that for the funding or whatnot. However, in case you need a letter of exemption or whatnot.
Yeah, I mean, these projects are not funded, so
yeah, but we're happy in the future to do that as well. Once you get into funded research or whatnot, we're happy to do that. Just so you have something to say that Western has said. I've seen so many times someone go through the research and not think about the ethics process, unfortunately, until after the research is done, and they've got to come back and they can't use the data, things like that. So even just having that conversation with us is 100%, very helpful to make sure that you're in the right direction. But yes, you have defined it pretty well there. And that's actually how TCPS starts. All research involving human participants needs ethics approval unless it's this. So yeah, it's a good way to put it out. So submitting your application. Like I said, we're not going to go through the full application form here because we could be here all afternoon, but I am happy to have one-on-one or have another session on that. I'm happy to do that. So submitting your application form. So once you go through Romeo, there are, I think, 12 sections in the Romeo form. You'll go through the Romeo form and enter all of your information for your research project. You'll attach your study documents, so any kind of consent documentation, any kind of recruitment documentation, any kind of instruments you'll be using. Everything will be attached into the Romeo system. And then you'll want to make sure that you attach all those documents and you run it through your principal investigator for sure. And then even someone else, you can run it through someone who's external to the research that you're doing. So maybe a spouse who who's not in the same kind of field of work as you, someone else who can read through that and just say, as someone who's what it is you're doing, and that's going to convey properly. But definitely run it through your principal investigator because they have to review the protocol before they can submit that to them. And how do you follow our templates? I'm going to talk about that in just a second. We do have on our website a really great section on templates you can use for recruitment documentation, debriefing forms if needed, photo release forms, consent documentation, things like that. So we have created that just this past July, and many of the researchers have said that's been very helpful in creating those documents. So they're not mandatory, but I would strongly advise and urge you to use those. I have forwarded a copy to Dr. Clark as well of a more simplified version of the letter of information for use that I think might be a little bit more helpful with the kinds of projects that you're doing. So he'll distribute that, I believe. I'm going to go over that today as well. Yeah.
I'm sorry, I hope you don't mind me coming in, but
no.
I know you're not going to go through actually what's on the form right now, but it might be useful just very quickly to tell our students, how extensive that process is, because some of them are deciding whether they're going to do what kind of methodology they're going to use. Well, in all honesty, right? And to an hour, or is it going to take a couple of days of work to put the form material together? Can you give us a sense of how that works?
Yeah. So the application form, it's going to ask questions. So I'm going to go through a couple sections, just kind of what's in my head here, just so I can give you an example of what's in the sections. So section 1 is going to ask you a brief summary of your study. That's easy enough. Couple sentences about what you're doing in your study. It's going to ask if your study is funded. Your studies aren't funded, so that's a no. It's going to ask if this research has been approved elsewhere. Section 1.3. So depending on if you're working with any collaborators in your research, that's a pretty easy question to ask. And section 1.4 is going to ask what are the roles and responsibilities of everybody working in your study team. So that's a fairly straightforward section. It's kind of an administrative section just to kind of let us understand overall what's happening in your research. Section 2 kind of gets into the meat of things. So section 2 is what are your hypotheses, your research questions, and how are you going to answer those? So what kind of procedures are you going to use with the research participants to get to the answers to those questions that you're asking? Now that's probably the most that's the most information you're going to put into the application is section 2.1. And my biggest feedback to you there, my biggest advice would be to say that just make sure you're very clear in the procedures that you'll be using. I think sometimes people talk about the whole history of their methodology and why they've chosen the methodology they're using. We don't want to know that. We want to know the procedures. If I'm a student or if I'm a participant, what are you going to be doing to me to answer those research questions that you have? So that's really important to remember that. And then section 2 will also go into inclusion/exclusion criteria. So who can be in your study, who can't be in your study. It's going to go into kind of what instruments are you using. So are they going to be instruments that you created yourself? Are you going to be using standardized instruments, tools, questionnaires, surveys, things like that? How long will the research take? So how many visits will each participant go through? How long will each visit take? It asks for an estimated number of participants, but that's just estimated, so we don't ask for an actual definite number anymore. We just ask for how many participants you think you'll be looking at in this research. Going to be asking if you're going to be using any kind of deception in your study, which I don't know if that will happen in this. No, it's more a psychology thing. So those 3 questions right there. So I mean, they're very straightforward questions that you'd be thinking about in a research proposal anyway. So you're kind of just taking the information from your research proposal and plotting it into the form. The next section is going to be on recruitment. So how are those participants going to get to you? The next section is on consent, and we want to make sure that there's no one in a position of power over those participants. So in both the consent and the recruitment process, we don't want anybody in a position of power recruiting or consenting those participants. So for example, a teacher shouldn't be recruiting his own students into his own research. You'd want to have somebody who could come in as a third party, or you'd want to come and work with us and we could help figure out how to do that best. So recruitment, consent procedures, both of those sections are just 4 little questions you've got to answer. And then you're going to get into the confidentiality section and security of your email address. With collecting identifiers does come at an increased risk of a privacy or data breach, right? So we want to make sure that that information that you're collecting is actually needed. Sometimes people will say I'm collecting a full date of birth, but what they actually need is the age. So they'll just say can you collect an age instead? And maybe you can't do that, and we can work on that. But how is the data going to be stored? So how are you storing the data? You want to make sure that any kind of identifiable data is stored at an encrypted source. So we don't want to have any kind of identifiable data and it just be left. These things are very. You have to protect the research data just as much as protect the research participants as well, not as much, right? So. Audio recordings of interviews and whatnot. So how will they be secured? You put them on your computer and encrypt them in some way. We'd be using an encrypted device to do that. And the questions really bring this information out. So I'm saying a lot here, but there are only actually 4 questions on each of the sections, I think, once you get past section 2. So the form also, what it does is refer back to guidelines on our website. So for the confidentiality section, it will say, do you agree to follow the guidelines we provided on our website to keep the data safe in your research. So we do have a lot of really great guidance on our website that I will refer you back to. And then some of you may be using quotes from research participants. I'm not sure if that will be the case, but sometimes that happens in this kind of research. So I'm going to go through that on the consent form template, but any quotes that you're going to want to use from somebody will have to be you'll have to have explicit consent to use those quotations from somebody. And I'll go over that in just a second. So could you get through in a half an hour? Probably not. I mean, it's something that you also need to put some thought into. I've had applications that have had, one-line answers throughout the application, and they've just been sent back because there's not enough there for you to even look at, right? So someone has very quickly gone through and just thrown something into an application form. So put some thought into it. But if you have a research proposal, or you have a very good research question and research design, then I wouldn't really worry about transferring that over to the application form, because it should transfer over very easily into the application form. Does that give a good overview?
That's
okay.
helpful.
It's kind of very high level, but yeah, we have really tried to get the questions as straightforward as possible. But that section 2.1 is the one that some people kind of get a little bit messed up with there, because we want to make sure that we actually know the procedures you're going to be using. So 2.1 is really important to make sure.
Yeah, right. Just on that, are you guys wanting to include the actual survey questions?
Yeah, yeah. Yeah, so in the attachment section in Romeo, you'll include the survey questions. If you're doing an online survey, I'm not sure if that's the case, but if you're doing an online survey, you can either include the link to the online survey, or you can provide us the just a list of questions. And then there's a section on the form called online research, and it's just going to ask you 3 questions there about ensuring that people won't be entering their name into with the data, things like that. So we ask for a couple confirmation questions there, and then just provide the survey questions, and we can review that.
Just following up on that, and you might get to this later. It's been, and all of that sounds very much like what we've been doing in-house. So there's no big changes in terms of the questions on the form. If many people here will be interviewing and using semi-structured interviews. And we've in the past required them to list the topics, but not necessarily the specific questions, because semi-structured interviews are by definition somewhat fluid. Is that so?
That's perfectly fine. Yeah. So kind of topics or probes that you're using, because we do know that semi-structured, you don't have an exact list of questions. So probes and topics are perfectly fine. So the process as it is, you submit your application in Romeo. Your principal investigator submits your application in Romeo. The office reviews it. So either the full board reviews it, or the delegated reviewer and the ethics officer review it. You receive feedback from us. So the feedback is always provided to the principal investigator and anyone listed as a research support staff in the Romeo form. So if you're submitting the application form and you're the student on the project and you want to receive the email correspondence from us, just make sure to list yourself as research support staff. The other 2 options are co-investigator and student. But unfortunately, Romeo, we will not get into Romeo and all its faults today, but Romeo will only understand that, will only send to the research support staff. So that's just one thing to remember as you're submitting your application. Little note there. So once you submit that to us, we review it, send your comments back, you submit your response to us. The important things to remember about submitting that response to us. So this is the response to the questions that we've asked about the initial application form. Just make sure that you include a detailed response letter. So that response letter is going to clearly detail each recommendation we've asked from you. It's going to detail your response to us and where the changes have been made. The reason we've asked for that is because we see a very high volume in the office, and it's very easy for us to then just go through and say, okay, yep, the change is made, here's the change, here's the change. We can go through them very quickly and help try to move that process along. So it's really you acknowledging that you've seen every recommendation and you've responded to it. Along with that, we do need to have the tracker copy of your protocol form. So Romeo, unfortunately, you can't make changes in the Romeo form that we will be able to see. So what we ask you to do, and this is very clear in the actual recommendation form that we send out to you, is to export a copy of that form to Word. It's very easy to do in Romeo, and those instructions, like I said, are on the recommendation form. Once you export it, you would just track the Word document as you would any Word document that you would just track changes. So we can see clearly where the changes are made in the Word document. So again, we can clearly go through and check off what has been changed. So you're going to submit the recommendation or the response letter, a track copy of the Western Protocol, and clean copy. So we want to see the changes that have been made, and we want a clean copy for our files. It seems a little redundant, but the clean copy is for our files in case we're ever audited. So the auditors can come in and look at the clean copy. The track copy is for us to clearly go through and see where the changes are made, so we can do that quickly and get that back out to you. Yeah.
Self-serving question, but when you say you, do you mean the PI, in other words, in our terms, the supervisor, the faculty member? Or can that be delegated to the research support staff, in other words, our students?
Yeah, exactly. Good question. And yes, that the student can do all of this. The PI again at the end will hit the same. Yeah, good question. So there's a little bit of work that goes into the response, but as long as it's submitted accurate, as we've asked for it, and like I think the instructions are very clear in the recommendations letter, then we can get that back out to you quite quickly. Yeah.
Just to follow up on that, so does that mean that all of this can be done electronically and we don't have to be in the same place, etc.?
That's right. Yeah. Yeah. So that's one good thing that Romeo will do is that the student can be here. You could be somewhere in Argentina on vacation or whatever you're doing research, whatever. And the student can be working on it and they can send an email and say, "Can you please log in, make sure everything is correct?" And yeah, that works perfectly. So that's your response coming in. That gets submitted to the office. We review that in the office. If everything is complete and everything is the way that we've asked it to be, then we will give you your approval. And please do not start your research until your approval has actually been emailed to you. So many times in the past, I've seen people get to this point and say, "Oh, as soon as I make these changes, yeah, we'll be good to go." But you don't have approval until you get that approval letter. Just as a reminder. Seems very straightforward, but it's happened quite a few times. Okay, so letter of information and consent. There's like 15 minutes left. Is that?
Yeah, I don't know if there's somebody, Jeff, do you know if there's a booking for the room at 2:30?
I don't know, I'd have to check.
But I don't want to keep people longer than 2:30.
Well, the class, it's our class in here
All
at
right,
3.
so
yeah.
there's, most people are here for the class anyway, so let's,
Okay.
so we can take a few extra minutes.
Perfect, okay. So the letter of information and consent. So we'll work through the letter of information and consent. Like I said, I forwarded on the actual document to Cora. He will send that out to you. There is also one available on our website, a template that you can use for the consent document. It is a little bit more detailed though. So the one I sent to Cora is more simplified, the one on our website is more detailed, but they're going to give the same information across to you.
I'll forward everybody to something.
Thank you. So when carrying out the consent process, it should be thought of just as that. So the consent process is not you walking into a room and the person you're interviewing and saying, "Here's a lot of information, read it, I'll be back in 20 minutes or 5 minutes, make sure you sign it." It's a process. So I mean, and that changes too with the level of risk of your research. So depending on the level of risk, like Dr. Hart said, these are probably going to be lower risk projects. They're going to go through the delegated review board. So this isn't going to be like a 2-hour process. It's going to be okay, here's a lot of information. Do you have any questions about the study? Do you understand what's going to happen? All right, let's go ahead and get started once you sign this. Okay, so it's just make sure that someone is fully aware of what's happening in this research study, especially if you're getting into using public figures or if you're getting into using personal quotes, things like that. You want to make sure that they're fully aware of what's happening. So like I said, it should be a conversation, and then make sure to answer any questions they have. So it's just a conversation you're having in addition to giving them that document. Like I said, here is on our website here. So these are all of our links. They can be found by going to the non-medical R&D website. And then we have recruitment documents, consent documents, assets for children, and other materials down here that you can use. So, like I said, I passed the template on to Dr. Horak. I'm going to go over some of the key things here, just where we see a couple of different issues that we see when we receive these. So this isn't the whole lot of information, but this is some key sections that I'm just going to help point out here. So institutional letterhead or the logo has to go on the letter. Make sure that's on there before you submit it to us. Project title, contact information for the principal investigator and supporting team member. So there should be some indication of who's responsible for this research. And again, that goes back to the question we had about principal investigator, supervisor, whatnot, but we want to know who's responsible for this research so that participant understands kind of who they can contact if they have any questions. That's going to be reiterated at the bottom of the letter as well. So the letter of information, the part that the participant reads, is called the letter of information. The part they sign is called the consent form. So the first section is just to provide an invitation to participate and explaining why the participant is being asked to participate. So how did they get to you? So you're being invited to participate in this research study because you are someone who is involved with local politics. and I found your name through X, right? So it's kind of giving them a good indication of where you found their information, why they're being asked to participate in the study. I give an example on the medical side of, if I'm a healthy individual and I'm being asked to be in a diabetes study, why am I being asked? Well, you're being asked to be in the study because you're going to be the healthy control of the study. But if I'm being handed a lot of information for diabetes, I'll be like, why are you handing me this? So it's good to just kind of put it right out there. Here's how I found you. Here's what the study is about. Here's why you're being asked. The study procedures, so section 5. So it's, again, just like in the Western protocol in the application form in Romeo, section 2.1, this is going to be kind of the meat and potatoes of your letter here, right? So this is going to be outlining what procedures will be taking place, how long they'll take, where they'll be taking place, if audio recording is going to be taking place. So you can either audio record and say, if you don't want to be audio recorded, you can't be in the study. That's perfectly fine. Or you can give them the option. So if there's an option, you'd have to also consent and put on the consent as well. So I want to audio record you as part of this study, but if you don't want to audio record, that's perfectly fine. I'll take written notes, and they would have the option to say yes or no on the consent form. But everything here about number of sessions, the number of interviews you might be doing, the survey you might be you'll be doing with them, where it's going to happen, if it's online, what kinds of questions will be asked, and not every question, but the kinds of questions they might be asked. If they're very personal questions, maybe they want to know that before they say yes to participate in the study. So this is really the kind of bulk of the letter to tell them what's happening in the study. Any questions about that so far? Voluntary participation, so I just left this one on its own. Section 9. So this statement here has to be included in every letter of information. So throughout the template that I provided, it's going to give examples of what could and what could not be provided, ways you could word things. But this wording is mandatory for all letters. Just make sure when you're submitting it that you're only putting in what it actually refers to here. So if you are not caring for that participant, don't please care. It happens like 80% of the time. So it's just a silly little thing where we provide the template and just remember to change it when you submit it. You don't waive any legal rights. This is something that is required by the Tri-Council policy statement, so that's a requirement. We can't take that out, unfortunately. But we will ask you to put that in there if it's not included. And then the second last section I'm going to talk about is, like I talked, the personal quotes and focus groups. So I'm going to be using focus group research as part of the research. Yeah. So in the focus group research, we can't tell anybody that we can't ever guarantee confidentiality of data. But especially in a focus group where you're going to be having a group of people talking who may talk about that outside of the research. You're going to say, please don't talk about this outside of the research, but they might. We put this kind of this wording here to just make sure that they know, the participant knows that even though what they talk about in the research should be confidential, you can't confirm that somebody sitting there won't discuss it outside of the group. And the second thing there is use of personal quotes, titles, names, other identifying information. You can do that as long as you have consent for that. So you'd have to get explicit consent for that, and it would have to be on the consent form, like a checkbox saying, can I use personal quotes? Yes or no. You would sign yes or no, and you can then go ahead and use them or not use them.
Even if those quotes are not identified and they're not attributed to specific individuals or even an identifier?
So non-identifiable quotes wouldn't have. So yeah, so this is referring to identifying, which is not 100% clear, but non-identifiable wouldn't be the equivalent.
So a student in their final report of the research, they add quotes and it may simply be identified as employee A, or any of that would be fine, you would leave this.
As long as they're not being identified, or as long as they can't be identified. So if you're saying employee A, for example, our office, we're all women, let's say we had a male employee. The male employee at the Office of Business Ethics, you would know,
right.
Like you could find out who that is. So as long as you can't get back to who that person is. Right? The last thing here is the little thing again, page numbers and version date. The version date is really important. Romeo isn't great at keeping track of dates for us on the document, so we want to make sure that you're always using the most current document that you've created. So it's important to put your own version dates on every document that you submit to us, just so we can keep track of that as well. That way we always know kind of what is the most recent protocol or letter being used, things like that, so we can go back and check quickly. And then the last section of the consent form that I want to talk about was the actual consent. So written consent will always be the default for a face-to-face interaction. So if you're having an interview with someone and you're face-to-face, we're going to want to have written consent in that case. But if you're doing the survey or the survey over online survey, or if you're doing an interview in a telephone or a Skype type setting, then you could use an alternate form of consent for that. So written consent, we use the consent form. It's got the signature lines on it, as on the template. The alternate method of consent could be implied consent by completion of a survey, or verbal consent by, over the telephone you read a script to them saying, here's what's going to happen in the study. I sent you a copy of the information ahead of time so you can take a read over it. Do you have any questions? No? Okay, let's go ahead with the study. And that template is also available on our website as well. And it's a lot more straightforward than this one, because you would still be using this format as well. It provides that script for on the telephone that you would use. Any questions about that? So you can have the written consent for face-to-face, verbal consent for over the phone, or implied consent for a survey type study. And each one of these would be okay for that online survey type. Any questions about that? So that was a very brief run through. Like I said, the template is stuff correct, so circulate it. And it's very straightforward. I think that one's a lot more straightforward than the online. It looks just like this, but with more sections in there. And if you're unsure about what to put in, so if you're unsure, do I need this section, do I need to add this in there, just send us a quick email or a phone call ahead of time. That way it's not being held up for that once it comes into the office, right? Couple quick slides here on public figures. I've already gone over some of this stuff. The consent requirements for public figures for aptitude for citizen research through interview or access to private papers are the exact same as anybody else. So we actually had this be clarified by the panel on research ethics, who are the people who have created the Tri-Council policy statement, because there were some people were not sure about this. So we had someone who had a document from many, many years ago that said that public figures didn't need the same kind of consent or ethics approval as someone who's not a public figure. So we've had this clarified that yes, same consent would be needed for doing the interviews or access to private work. And then just in addition to that, the researchers can use publicly available information as long as there are no limitations of privacy. In fact, the research is solely based on this type of information about that is exempt from research ethics approval. So just like I said at the beginning, this is Tri-Council policy statement number 2.2, which would say that if you're using any of this which is publicly available, then ethics approval may not be needed. So that's kind of the only thing I'm going to say about public figures, but for the most part, you're going to treat them the same way. But just watch if ethics approval is needed or not needed, and we'd be happy to answer any questions about that as well. Questions?
I don't want to preempt things. Do you have a bunch more things to go through?
I think it's very basic, just general office stuff, yeah.
All right, so this is a good template. It just, to give people a bit more of a picture, for a couple of questions to give people a bit more of a picture of how a letter of information and consent form actually works and looks. So first of all, I just want to confirm with you that a letter of information is not going to look like that with a number of points, 0.6, 0.7. It's going to be an actual, that's just the form and the template. It's going to be just an actual letter saying, hello, this is me, I am so-and-so, doing a study under the supervision of so-and-so, this is what we're going to be doing. So correct, right? So it's meant to be like a real letter, not
so it, either way,
formal points.
So I mean, you'll see in some of our psychology studies, it will be laid out more like this because it's kind of more of a here's what we're doing. But if I know there are some sort of law and Ivy will sometimes write their letters a little bit more flowing, like an actual letter, and that's perfectly fine as well, as long as you have all these points in there. That's something that we're really careful to watch for. If all the points are included and it reads a little bit more like a letter than a 1 through 5, that's really fine. Just make sure that everything is included.
And my other question, maybe you can clarify for these folks, is, I mean, most likely, and people who are going to be doing the work here will either be doing an online survey or some in-person interviews. There might be others, but those are the most common tools that our students tend to use. For the online survey, I'm presuming that what they would do is put this letter in the form of an email, right? And then approach a person that way, correct?
So there's usually an email recruitment that would go out. So you'll send an email recruitment email saying, here, my name is this, I'm doing this research study, and then please see the attached survey. So then the letter would actually be the first page of the survey, because we want to have it on the same document as the actual survey to make sure
Okay,
they're
that's
reading.
useful to know.
Yeah.
Okay.
So it's kind of a email recruitment, just a short little, I'm doing a study, please see attached if you're interested. Then they can open it up if they're interested, read that letter of information, and continue on with the survey if they're
Got it. Okay. And now, I guess same question for interviews. Is it acceptable then to send your prospective interviewee a brief paragraph saying, would you like to do this, and then bring the formal letter of information and consent to the interview itself?
Yeah, or you can send a lot of information in an email ahead of time, so when they get there, you can kind of give it to them again. They'll look over, you can answer any questions they have, but they're always going to maintain a copy of that letter of information no matter what. So they'll have a copy of that. So you can either email it to them in the first place, or you can give it to them at the interview. But give them a chance to read it before too, gives them a chance to get any questions they might have for you, or say, I'm not interested in this at all.
Yeah, thank you. I think it's just useful for students to kind of visualize how that works. Right?
Yeah.
And I know in the past, we've run a lot of these projects, and sometimes one thing to be sensitive to if you're doing this kind of work is that is in presenting a project in a way that's ethically acceptable to the prospective interviewees or survey respondents, but not unduly off-putting, right? And so, because if you as a policymaker get, a very long, choppily written, indigestible letter and a form where you have to sign, you're probably just going to go, I'm not going to bother. So then, the short paragraph saying, hello, I'm so-and-so, I'm doing such and such. If you want more information, here's an attached letter. I can bring it to the interview. Are you willing to talk to me? That sort of thing.
Yeah. And again, that's where that consent that conversation comes in really really well too, right? So you're having a consent conversation. It's not just that my name is this. I am going to be doing this. It's like, we just want to have a conversation with you about this, and you've already read the other information, and you can go over the key points, things like that. Okay. Yeah.
I have a related question. I think it does only relate to people who are working for an organization and who are doing research that relates to that organization. I think you said earlier on that secondary data that's already collected is not subject to Western's ethics review. That process,
As long as
right?
it's anonymous. Yeah.
Yeah. So I understand that to mean that if, as part of one's job, you collect data, and that you can use that data for a Western project, as long as your own organization agrees that that's a proper and correct thing to do.
Yes. So if the data has been collected with no identifiers, it's been
Yeah.
anonymous.
So the data would belong to your organization. It wouldn't have anything to do with the principal investigator or to the supervisor, to the student. It would be the organization's data. And if you're working in a municipality, it would probably be available through Freedom of Information request.
Yeah, so as long as there's no way you can link that back to the identifiers, and you can't identify that data, then
So for some people, it might be worthwhile having a conversation with one's boss about whether they would be agreeable to doing that research.
yeah, and in that case, I would just again run it past us just to make sure that we've dotted all of our I's and crossed our T's to make sure that yes, that is what you're doing. You're not going ahead and doing something that you shouldn't be doing, right? 'Cause that,
What would you be checking?
just to make sure that you can't identify it back. So I mean, as long as you're completely confirming it's completely anonymous and there's no way you can identify it back, then you can go ahead. and you can read Tri-Council section 2.2 and confirm that for yourself, but if there's any way that there's identifiers that were ever on that data, then you're gonna wanna make sure 100% that there's no way you can link that back.
It would be the other organization's problem, not Western's
It's not a
problem.
problem, it's an ethical issue. So you can't just, so if it had identifiers on it at one point, there has to be no way you can link those identifiers back. Then it doesn't even fit into section 2.2, so you need ethics approval. So if it can be identified in any way, it's not an organization thing, it needs ethics approval. This is only for completely anonymous data in section 2.2, or if there's no way you can link that data back to who it belongs to. Okay. And that's why it's sometimes just good to have, that's why I said just have a conversation with us, just to confirm that that's exactly what's being done. Because some of those Tri-Council articles can get a little bit muddy, and that's why we're always here to help make sure that that's 100% clear.
So I want to be able to give people a chance for a little bit of a break, and I'm going to say let's take until just past 1:45, so another 7 or 8 minutes for a couple more questions. And then people can also follow up individually. Welcome to, I have some ideas about more information I'll send out to you. 2 minutes to 5, so but we have some more time.
Yeah, I just want to reassure our students that your faculty are here to help you and advise you. This sounds like a very daunting process, but the faculty have been through this. We've done things like this. We've drafted these letters of consent and so on. We've had approved notes, things, and we will help you move your way through the process. So this process has been presented where you start filling out the form and we approve it later to go up the chain. Work with us at the front end to put it all together. Don't run your own.
Absolutely.
So I know that's implied, but I just want to say it outright.
Yeah, we would always say that. I mean, that's why the supervisor is responsible. That's what we're trying to say here, right? Is that they've done this before. They've gone through this process before several times, probably. So just make sure you have those conversations because they may have had things put through in the past. You may have done things in the past as a supervisor or as a researcher that didn't fly, and you'll just know, let's find another way to do that. And again, keep the conversation going with us as well because we can help work some of those things out as well. Yeah, there's lots of people here, faculty members, board members from this department, faculty, and in our office as well. Thank you for that. In the back.
When you were talking about how if you're doing stuff that's entirely anonymous, you're good to go, but with mine, I'm just thinking, I'm going to be looking at decisions that have been made public. And I might use those as case studies, and their names mentioned specifically. Would I still have to go through you guys, or because it's public information? Does that make sense?
So if it's been made publicly available and it's publicly available information, then you can use that without it. I think that's 2.3 in the Tri-Council policy statement.
Okay.
Yeah, so you may want to take a quick read of that, and then if you have any questions, we can talk about your specific research. If you still want to run it past us, I'm happy to do that. Once you've given a read to that section, it's a short little section. But publicly available would require ethics approval. And so in what you're saying here, if it's publicly available information, but I'm just worried about the fact that you were the person who would be working for the organization collecting it, and then it might not be anonymous. So I feel like there's a little bit of a muddiness.
These organizations have their own policies about privacy and making data available. So
yeah, but they're not. Are they collecting it for research purposes in the first place?
Well, sure, these organizations do research all the time to find out what other municipalities are doing, how different problems are solved in different places, what people's attitudes are towards different things. So sometimes it's part of people's job at work in order to do that.
Yeah. So, and would it be publicly available then at that point?
Yeah, you could make a freedom of information request to get it, unless there was private material, in which case the municipality would not be allowed to release it.
Right. Okay. Yeah. And that's sometimes we just need a little bit more jogging because I don't deal with this every day, right? So it's good for us to understand it completely as well before we review these things and before we answer questions like this. So thank you. Another question in the back.
Just along those same lines, I was just wondering, if there was a consultant's report or something done, which technically could be available through a freedom of information request. So it's not like it's on the municipality's website or something. There wouldn't need to be an ethics approval process there if
it's been made publicly available.
Well, but maybe you just asked and someone gave it to you. But if technically, if you would have gone through a freedom of information process, they would have had to have given it to you.
And it's anonymous data, it's a report, right? So there's no.
Well, but there could be, I guess, they could ask people in specific positions about how this service is delivered or something like that.
And what we do is we're dealing with governments that are making policies.
Yeah.
Right? So they collect information, they hire consultants to study things on their behalf, they arrive at the end of the process, they make policies, or they regulate things, so people apply to them for the right to do things.
Yeah.
Accumulate these applications that are approved or not approved.
Yeah.
And they may not put every single one. The applications don't necessarily, all those decisions don't appear on the website somewhere, but they're known about in aggregate. They are discussed individually in meetings that are open to the public.
Yeah.
They can be subject to freedom of information requests. So these are governments that deal with public information that originates in private processes, right? But
And it might be useful for us to sit down with some of the faculty and go through. So currently we actually have no board members from this department of political sciences on our board, which is not helpful in your case because there's nobody here who can help advise on some of these questions, right? So it might be helpful to sit down with a few faculty and just go over some things in some different situations so we can make sure that we're all on the same page because this one, maybe we are looking at it wrong. Maybe we're not understanding it 100%. So maybe that's what we need to do is create some more guidance. And we've done that in other departments and faculties. With anthropology, we worked on different questions that they had and thought, we'll talk to the experts and see where we might be not understanding things. So I'd be happy to go through some of those things.
I think this is really important because every year there's going to be a couple dozen of these master's students who are going to be doing probably 3 or 4 distinct genres of projects.
Exactly, yeah.
Right? And if we can create our own little manual,
Yes,
right, that nests within your more general stuff that you approve of.
Exactly.
I think that might be
It'd be really helpful, yeah. I'd strongly support that. I think it would be very helpful for everybody who's a stakeholder in this. So we could maybe chat about that and maybe get together and help start that. And that's the thing we want to try to do is try to help people. We know the things that we have to review for. We've seen things that have happened that we don't want to get you into as well. The supervisors are very clear in things that they don't want you to fall into as well. But there are also, we have to look at it from your side of things too, where this is how the work actually happens. So we don't want to put that boundary up because we don't understand what you do. So let's have that conversation and we can start working on things like that. My last couple slides were just very administrative, just so you guys know where we are. Here's who all the officers are now. He's not here anymore, I apologize. But here's who we are. Here's where we are. So online, here's our website that I mentioned I indicated at the end of the class. So you guys will know where to find us. The general email address for our office. And then we're just across the road in Support Services Building, 5th floor. And there's our website. So like I said, make sure you keep looking back at our website just to see any kind of updates or anything. But I would like to continue that conversation about that and principal investigator stuff as well, just so we can make sure that we're all clear on what we need to do there. And those things would appear on our website when it's going to become available. So thank you so much for having Caitlin and I today. Really appreciate it, and we'll keep some of these conversations going to help improve the process.
Okay, thank you so much.
Thank you.